Hello, this is my assignment 1 for medical terminology. I'm going to start with part 1, just reading through my summary for part 2. So, part A would start with greeting the patient, so saying my name is Cassidy Leake, make him feel comfortable or her, so just basically tell her that whatever she's feeling is normal and valid, nerves are normal, pay close attention to my body language, tone of voice, and making sure to smile. So for part B, it says briefly summarize what will occur during the surgery. So I wrote that after a diagnosis of skin cancer, oftentimes Mohs surgery is the suggested course of treatment made by a dermatologist. The purpose of a Mohs surgery is to remove infected cancerous tissue from the affected skin area one layer at a time, starting with the epidermis until there is only cancer-free tissue remaining. And this was described by the Mayo Clinic. The goal of the surgery is to find where the abnormal cells end and remove tissue up until this point. So then, as far as discussing the skin cancer be removed, the type of skin cancer to be removed is basal cell carcinoma, which was found on the patient's cheek. And then for part C, provide a 1 or 2 sentence description of the explanation of the type of skin cancer. So basal cell carcinoma is described as tumors that start out on the outer layers of the skin, known as epidermis. Although they are typically located in one specific area, also known as localized, they have the ability to spread. Basal cell carcinoma is less dangerous than many other types of skin cancer, but can still have its risks if left untreated. And that was described in the textbook. So explaining who will be performing the surgery, the title of the surgeon. So the surgery will be done by a dermatologist who has completed the training necessary for Mohs surgery. The main procedures and instruments that will be used. So a localized anesthetic will be administered to numb the skin in the affected area, which in this case is the cheek. And a scalpel will then be used to remove the visible portion of the cancer, which is the actual tumor on her cheek. The doctor will then take the tissue to the laboratory to be examined. There'll be a small waiting period for results to come back from the lab. While the patient waits, the doctor is going to cut the sample into grids and place them on basically a map in order to make sure they know exactly where on the cheek each piece came from. This will allow for the surgeon to target specific areas that are deemed necessary after receiving results from the lab. If the results show that some cancer still remains, the surgery will continue and the doctor will remove another layer of skin from the affected area. The surgeon will be cautious to leave as much healthy tissue as possible alone while taking out all cancerous tissue. This process will continue until all remaining tissue is cancer-free. That again was from Mayo Clinic. So explain how long the procedure may take. So that varies depending on the extent of the cancer that is found on the spot. So it all depends on the lab work. Some it might be one round of just cutting off the superficial layer, whereas for other people they might be in there for hours between the actual surgery and waiting for the lab results to come back. So it varies. So the importance of wound care and following discharge instructions and minimizing the risks. Just basically discuss the importance of keeping it clean and following the paperwork that is given to them, like their outpatient paperwork that's given to them by their surgeon. Usually a nurse will go through it with them to ensure that they understand everything on there and they have no questions before they leave. In addition, making a follow-up appointment. So although after surgery, most surgery has very high success rates, there's still some small chance of reoccurrence. So regular checkups are recommended periodically. And the patient should plan on scheduling to get stitches removed if they were used 5 to 10 days after surgery. But that varies also depending on the extent of the carcinoma, because in some cases they'll actually have to have a skin graft if the open wound is too big for stitches, or the doctor just thinks it's a better fit for their specific case. So that's it.